Hello, I'm Dr. David Hamilton, and this is a reading from my book Why Woo-Woo Works, and this is from Chapter 1, Mind Over Matter. They're not getting better, they just think they're getting better. This was a typical sentiment expressed by my pharmaceutical company colleagues when I asked for their opinion on the placebo effect, a phenomenon that was particularly relevant to our work given that the drugs we were developing would be tested in clinical trials. This view was always offered amicably, but it underlined the assumption, held for decades, that the placebo effect was all in the mind. If a patient who had been given a placebo in a drugs trial got better, it was written off as part of the natural course of their illness. It would have happened anyway. A placebo is an inactive or dummy treatment in the form of a pill, injection or device that's administered in clinical trials to test the real drug or treatment against a control, i.e. comparison. As such, a placebo isn't designed to have any therapeutic effect on the patients who take it. However, in reality, it often does. And when this happens, it's because the patients believed the placebo is the real drug or treatment. It's their belief that does the work. Belief alters biology. The placebo effect might appear to be an illusion, but science has shown that belief itself has real biological effects. Admittedly, this does sound a bit woo-woo. However, woo-woo is only woo-woo in our mind until we know the science, and then it's true woo. In fact, there's no question that belief causes chemical changes in the brain, and these changes are dependent on what a person believes. For example, patients can believe opposite things about the same placebo and get opposite effects from it. If a patient believes that a pill, if it's a placebo, will reduce pain, it will usually reduce pain. Yet if they believed it would cause pain, it would have done that instead. In the former case, the belief caused the production of the brain's natural versions of morphine. In the USA, scientists at the University of California at San Francisco showed that endogenous opioids, the brain's own morphine, was responsible for the pain-killing effects of placebos during dental surgery. But crucially, the endogenous opioids are produced in response to a person's belief or expectation that the pain will go away. If a patient believes that a pill, if it's a placebo, will cause pain, the belief blocks these natural opioids in the brain, essentially elevating pain. A belief that a pill, if it's a placebo, will help us relax, will bring about a calming effect. Yet, if we believe that it's a stimulant, we'll feel agitated and our heart rate and blood pressure will rise, even though in both cases the pill is a dummy. When a group of athletes were given substances that they believed would increase their strength and endurance, they did indeed gain strength and endurance. But the substances were placebos. Luckily, these performance-enhancing placebos, PEPs, couldn't get them banned from competition because they were, well, after all, dummies. Perhaps many athletes just need a pep talk. And in research conducted by scientists at the Departments of Psychiatry and Medicine at the State University of New York, 40 patients with either asthma, emphysema or restrictive lung disease were given an inhaler containing a nebulized saline placebo, but were told that it contained allergens that would restrict their airways. Before long, 19 of the patients reacted with considerable constriction of their airways. 12, in fact, had a full asthma attack. When they were given a different inhaler and told it would relieve their symptoms, even though it was also a saline placebo, it did relieve their symptoms. Therefore, that one placebo inhaler either reduced or created bronchospasm in asthma sufferers depending on what the patients believed it would do. One person even developed symptoms of hay fever when they were told that the inhaler also contained pollen. And those symptoms were again relieved when they were given another saline inhaler that they believed would do that. Studying the placebo effect. It's possible to use colour as a placebo because of what it represents to us. In the USA, in a unique way of teaching medical students about the placebo effect, University of Cincinnati medical professors gave a class of students pink and blue placebo pills and told them that they were stimulants and sedatives. It was found that the blue pills were 66% effective as sedatives compared with 26% for the pink pills. In other words, blue placebos were around 2.5 times better than pink ones for helping people to relax. This is because for most people, blue is a calming colour, and this informs some of what we believe it will do. The researchers also found that giving the students 2 placebos rather than 1 was even more effective. And as strange as it sounds, although perhaps not to parents, for children, a plaster illustrated with a colourful cartoon or a magical character reduces pain and heals a cut faster than a plain plaster. Where we live also affects the power of a placebo. In a US study of migraine treatments, placebo injections were found to be 1.5 times more powerful than placebo pills, while a European trial found that placebo pills were about 10% more effective than placebo injections. The reason for the difference lies in our cultural language. Americans tend to speak of getting a shot, so they're more likely to believe in injections, whereas Europeans talk of popping pills, or at least they do in the UK, so they place their faith in pills. In a similar way, in trials of Tagamet, an anti-ulcer drug popular in the 1970s and 80s, the placebo was 59% effective in France, but the drug itself was 60% effective in Brazil. Advertising budgets for drugs is higher in Western Europe than in South America, and more advertising spending creates a stronger perception of the power of a drug, but it also has the same effect on the placebo. I'm Dr. David Hamilton. This was a reading from my book Why Woo Woo Works, and that was from chapter 1, Mind Over Matter.